talk about multi-organ failure and how the sequence of events typically happens. And the first event is respiratory failure. And there is outstanding information in this textbook on how to manage a ventilator and respiratory failure. So you have a super sick patient, and this is not one size fits all, but this tends to be the progression of organ failure in patients. So usually someone's super sick, they develop acute hypoxic respiratory failure, okay, which would then require mechanical ventilation, okay? Now again, this is not A comes before B, which comes before C, which comes before D, but typically this is kind of how a critically ill patient progresses. So then they develop, and this a lot of times is simultaneous, I'll be honest with you, cardiovascular collapse requiring vasopressor support, okay? So they're in respiratory failure, then they're in cardiovascular collapse. Next thing to go is the kidneys, okay? So then they develop acute kidney injury, acute tubular necrosis, and acute renal failure requiring renal replacement therapy and hemodialysis, okay? And then the end of the line here is when this guy gives out. So if you get to the point where your multi-organ failure is so severe that you start to develop a transaminitis, your AST or ALT go up, and a hyperbilirubinemia, your bilirubin starts to go up, meaning you're in hepatic failure. This is kind of the point of no return. So there's not much we can offer at that point besides, quote, supportive care. And again, this is sort of the sequence of events in multi-organ failure. Again, it doesn't happen like that every time, but it's really, what you'll start to see when you're in the realm of critical care.